Thank you, Mr. President. Thank you, members. Senator, is it not true that almost every hospital, they've put together a group called the Texas Way to address this issue of the expansion of Medicaid in Texas? Is that not true?
It is true, Senator, and they have been very diplomatic about trying to avoid getting any of our colleagues behind the eight ball on this issue.
Well, because isn't it true that almost 80% of Texans are uninsured? Is that not the case?
What's that figure? I couldn't hear
is
me.
It 80%? Is it not almost 80%?
I'm not sure of the exact number. I thought it was more like about a third.
A third. All right. So the figures that I'm looking at, the myth versus fact, the Texas Way, my understanding, and I'm not sure if you'd be surprised by this, that if we were to draw down and expand Medicaid, that we would alleviate the cost of covering uninsured, which currently is resulting in an $1,800 a year in higher health insurance premiums to those of us who are paying for health insurance.
That's a good point. I hadn't thought about that, because obviously when people don't have health insurance, they wait until maybe the health problem is more critical because they're not taking the preemptive steps, and we all pay for that.
Well, we pay for it because of many of our hospitals, they obviously, when someone shows up at the emergency room, they have to take them, don't they?
Premiums, our insurance rates, as well as taxes.
Correct. And so that's the other question that I have. Did you know that if we were to accept this and expand Medicaid, we would reduce the tax burden on local property owners who pay for county indigent health care service by $1 billion in Texas?
I do know we would reduce that local tax burden. In terms of insurance rates, that's a more complicated issue. You know, we do very little regulation of insurance rates in Texas. I mean, that's a much more complicated issue in terms of the rates that we pay in insurance.
People who show up at the county or the hospitals in our districts, uncompensated care, the taxpayers at the local level are paying for that. Is that not the case?
That's correct.
And so the taxpayers have to pay for it in their property taxes.
That is correct.
So
it's property tax relief. I hadn't thought of that. This is a property tax relief.
$1 billion worth of property tax relief. And I know that we're all in support of property tax relief, is what I've heard. So did you know that if we expanded, that we would provide a tool for 48,900 veterans to access health insurance benefits? Did you know that?
Now, Senator, I was about to make reference to veterans earlier when I was talking to our distinguished colleague, Senator Taylor, and, you know, all of us owe a tremendous debt to those women and men who have served this country, and that is a very important point. Thank you for bringing it up.
If we were to expand this, did you know that we would eliminate almost $400 million in tax penalties for employers, business people who can't afford to provide health insurance for their employees?
That's an excellent point.
So to me, it seems like if we do follow your lead and we just commit to the 2 years that you said, like a pilot program, if you will, that we draw down federal tax dollars that are our taxes. I mean, wasn't there a time when Texans were mad that we were a contributor for highway tax dollars? We weren't drawing down enough money? Wasn't there?
Senator, it's such a good point. And you know, and when I add to that analogy, most of the Health and Human Services budget, over half of it, is federal money right now. And so that logic that some people apply, we don't want to draw it down because the program may go financially into bankruptcy. Right. They don't apply that to the rest of that Health and Human Services budget.
So the tax dollars that we're refusing to accept, our money from the federal government, they're going to subsidize other states. Is that not the case?
They're helping to keep the Affordable Care Act alive in other states. And as you know, you've probably seen the press accounts, the federal government may put more pressure on those states that don't draw down the money by not granting certain waivers that some states like Texas have been able to get in the past. I mean, there's going to be even more pressure on our hospitals if we don't draw this money down.
It seems to me that in doing this, we help people who don't have insurance. We help employers who can't afford to provide insurance benefits. We provide property tax relief for those of us who are paying for the people who show up to the county hospitals without insurance. So we're being good fiscal stewards of our taxpayers in the state of Texas if we were to do what you're asking us to do. Is that not the case?
Senator's right. We help veterans. We help on property tax relief. We lower tax rates to our counties and our cities. we don't end up in a position where, like in Harris County, because they do have a hospital district, surrounding counties and cities just send their folks who need access to health care to the Harris County Hospital District. You know, it's a good thing. You and I are both lawyers, and I sometimes have made reference to the fact that doctors took a Hippocratic oath.
Well,
and so they serve people. You know, lawyers sometimes can be a little hypocritical. We don't do it if somebody's poor.
I appreciate the promotion, but I did not go to law school. But I do want to say that I believe that everyone in this room wants to do what's best for the 26 million Texans that we represent. And so I think that in doing this, especially doing it the way you're asking, you know, if we can't get a bill passed to just do it all in, let's do a 2-year pilot expansion program. Let's just put the 50 million up. Let's get all those billions of dollars back home that are our dollars. Let's give people a medical home where children can go to a doctor and get a simple antibiotic instead of having to present at the emergency room with double pneumonia. Let's do the right thing.
And Senator, I'd even take it to the voters. I mean, there are a number of financial schemes or ideas that some of our colleagues have to divert certain funds, change the way we determine what the spending cap is, and submit that to the voters. I'm convinced, even if the voters were given an opportunity to make a decision on drawing down this money, without the state spending any money on a voter campaign, when they look at these numbers and say for you know, a relatively small amount of money, you can draw down $50 million to draw down $4 billion. You know, I think the voters would do that in a minute. Or the idea of putting up $15 billion to draw down $100 billion over a decade, I think that they do it. So I'd even accept that as a friendly amendment if it's the only way our colleagues could let this pass. Let the voters decide.
Senator, I'd like to ask to be a co-sponsor or co-author, whatever the proper terminology is, on your amendment. But also, if it would require that amendment, I'd also like to help with that amendment as well. I want to thank you for bringing this forward, because I think it's important that the people of the state of Texas know that we're trying hard to do the right thing. Sometimes it's difficult to express it because sometimes the bills that we like to present sometimes don't get a chance to get heard.